Sinus infection and types of sinusitis. A sinus infection, also known as sinusitis, is a common medical condition that affects millions of people every year. The sinuses are air-filled cavities, located within the bones of the face and skull. They are connected to the nasal passages and lined with a mucous membrane. The sinuses help humidify and filter the air we breathe, and their structure contributes to the resonance of the voice. Your sinuses are empty spaces in your skull. You have 4 pairs of sinuses for a total of 8. The pairs are named based on their location. Frontal sinuses. These are located on the forehead, just above the eyebrows. There is 1 frontal sinus on each side of the forehead. Ethmoid sinuses. These are small, air-filled spaces located between the eyes and behind the bridge of the nose. The ethmoid sinuses are numerous and form a honeycomb-like structure. Maxillary sinuses. These are the largest sinuses and are located in the cheekbones, on either side of the nose. They extend towards the back of the skull. Sphenoid sinuses. These are situated behind the ethmoid sinuses and are located deep within the skull, behind the eyes. There is 1 sphenoid sinus on each side. Let's discuss types of sinusitis. There are 4 types of sinusitis. Acute sinusitis, subacute sinusitis, chronic sinusitis, recurring sinusitis. Number 1. Acute sinusitis. Acute sinusitis is typically caused by the common cold, a viral infection. It is most common form of sinusitis and is short-lived. The sinus infection lasts for about 2 to 4 weeks. In many cases often go away on their own within 10 days, though symptoms could stick around as long as 4 weeks. You'll experience the following symptoms. Stuffy nose or nasal congestion that makes it tough to breathe through your nose. Thick green or yellow mucus draining from your nose, a runny nose or down the back of your throat, called postnasal drip. Pain, pressure, swelling, and tenderness around your nasal passages that feels worse when you bend over. You also may get a headache, have pressure in your ear, a cough, and other unpleasant symptoms. Your doctor may prescribe antibiotics if the cause of your sinusitis is bacterial. Number 2. Subacute sinusitis. Subacute sinusitis means that you have a sinus infection that lasts 4 to 12 weeks. This type of sinusitis falls between acute and chronic. If your sinusitis lasts more than 4 weeks but less than 12 weeks, you will be diagnosed with subacute sinusitis. Your symptoms may not be as severe as those you would experience if you had acute sinusitis. Number 3. Chronic sinusitis. If you have chronic sinusitis, symptoms of the sinus infection last longer, making it a chronic condition. A single infection of chronic sinusitis can persist for 12 weeks or more. Chronic sinusitis brings on the same unpleasant symptoms as acute sinusitis, but it lasts a whole lot longer. You won't be diagnosed with chronic sinusitis until you've had symptoms for at least 3 months. What causes it? That's not always clear. Many things increase your risk, including nasal polyps or small growths inside your nose, allergies, deviated nasal septum, in which the bone and cartilage that divides your nose get pushed to one side, often due to an injury. Recurring respiratory infections. Diseases that affect the immune system, such as cystic fibrosis and HIV. Number 4. Recurring sinusitis. Those with recurring sinusitis have 4 or more sinus infections in a year. It's not uncommon to get the occasional bout of acute sinusitis. After all, it goes hand in hand with the common cold. But for some people, it keeps going away and coming back again. If you get acute sinusitis 4 or more times each year, you have what's called recurrent sinusitis. Some of the same risk factors for chronic sinusitis also up your chances of recurrent sinusitis, such as nasal polyps, deviated nasal septum, and other abnormalities that can occur in or around the sinuses. If you regularly inhale tobacco smoke or other irritants in the air, you may have a higher risk of recurrent sinusitis. Sinusitis also raises your odds of developing a bacterial infection, which in turn makes recurrent sinusitis more likely. Stay tuned for more valuable content.